turn back to Karen again this evening, and we'll invite David Rotenberg to the stage. David is the Chief Clinical Officer for Karen. He's been at Karen for over 20 years and is recognized throughout the industry as an expert in treating co-occurring mental health disorders, family issues, and innovative approaches for treatment of adolescents and young adults. I've also heard David speak and talk about his own experiences, and very, very informative and a great way to introduce the subject. David, please join us.
Thank you, Judy. You can hear me?
Yes, sir.
Good? No? Close. Okay, so but I like to walk around. Okay. So anyway, I'll stay here. By far, my most important title is Karen O'Hum, and personally, in long-term recovery from alcohol and drugs. By far. Thank you for the nice intro. Treatment worked for me. Treatment worked for me at Karen, because I went to Karen and I did what they told me. And then when I left, I followed the continuing care plan, a critical element of any longitudinal recovery story. By the way, myself and Yvonne were 2 of 6 people in a small group at Karen. You should know that. So one caseload, 2 people from that caseload are speaking to you tonight. That's pretty significant. Oh, you should know that. I too will have 25 years sober on May 5th. So anyway. I went to Karen in 91, and I came back to Karen in 96 to work. I've had a front row seat of the evolution of Karen and the treatment industry. And occasionally, Mr. Beeman even lets me drive. I have to tell you, the evolution, the integration, the sophistication, the level of involvement and talent that has come to the field since I came in 96 to Karen is phenomenal. Phenomenal. And I have to thank Dr. Santoro for pointing out some of the messaging around our field. And I'll talk about that in a minute. Dr. Levine, too. You too. By the way, you did like 5 of my bullet points. So I say to you, what an honor. The Physician General did like a third of my PowerPoint. So, addiction is a disease. Of course, it's not a moral failing. Karen's an Ivy League rehab. We're an Ivy League treatment center. 60 years. We take our position in the industry, nationally, and locally in Berks County very seriously as a treatment leader, as a thought leader. Our generosity of spirit, our ability to give and to provide treatment are critical elements of what we do and what we believe in is part of our mission. Heroin and opiate addiction has been around for a long, long time, but did you know some staggering numbers? In 2015, we treated 650 patients with opiate addiction. Those numbers continue to rise, obviously. As Dr. Levine points out, they're going to continue to rise. 45% of adolescents that checked into Karen in 2015 had a primary heroin and or opiate addiction. The number went up for young adults, 50%, over 50%. And so we've become really well versed in helping people get into treatment and of course treating them. I know we're running a little late, so I'll try to keep moving. Medical assisted treatment, both docs talked about that. Obviously, Vivitrol doesn't perhaps get as much press as naloxone lately. But we love Vivitrol as our MAT of choice. We're pushing it as hard as we can. It's an opiate blocker. It saves lives. It prevents overdose. Doug Tiemann and Dr. Joe Garbely, our medical director, and this whole row is doctors here. So if you have any medication-assisted therapy questions from Karen, by all means, right here. They've worked with the makers of Vivitrol Alkermes to cut the cost and parlay that back into more use for our patients. Yes? Yes?
No.
Next slide. We have been gender specific for over 10 years. We found that treating most genders separately gives them a better shot at developing intimacy and discussing certain topics. Body image, easy example. Many sexual assault and abuse issues going on in a rehab setting. Is it on now? Thank you. So we take a lot of great pride in that. Obviously, a huge amount of family involvement. Okay, family disease, not just disease, family disease. We take great pride in educating parents, intervening on loved ones just the same. You guys talked about that earlier. How parents need not just education, but intervention. Multidisciplinary approach. We are lucky enough to boast not just a great counselor to patient ratio, which is usually what the state looks at when they audit you. I like to call it our interdisciplinary ratio of pastoral care, psychiatric care, fitness and wellness, counselors, psychiatry, psychology, docs, pain management specialists, nutritionists, alternative ed teachers. I could go on. Okay, we have outpatient services. My first home at Karen from 96 to 2000 was Karen Counseling in Wyomissing. Awesome community resource. Does a lot of work with TASC, does a lot of work with Berks Countyans, adolescent, family, adult, every level involved, including even pre-chemical dependence work. So, very good resource. My first year is a product that we've had for 3 years where we follow patients a year after treatment. Okay? The success rate of this program for those who participate for 1 year is 70%. If you know the drug and alcohol industry, you know that that is an astoundingly good number. 70% rate of recovery at 1 year if you participate. Treatment works. Treatment works. Participation in the appropriate continuing care plan works. Obviously, Karen sets the pace like no one else in terms of parent support group and alumni involvement. No one else. You see an example tonight. In fact, up and down the eastern seaboard, you see multiple examples of parent support groups that are not just Al-Anon, okay? They are referral networks, okay? They are interventionists, in quotes, but this is the work that these people do. It's amazing, some of the work our people are doing. Next slide. Student assistants, I've watched from 96 till now, I've watched Karen student assistants go from like 15 schools in Berks County to like 300, 400, 500, 600 up and down the East Coast, down to Florida, up to the Northeast. Obviously in Berks County, we're in every school district. We're proud of our SAP. We're proud of our our early intervention. And let me say this, I'm proud that we can, at Karen, educate a 10-year-old at a local school for prevention purposes and treat a 90-year-old up on the hill who's here in our seniors program. Open since January. Okay. Again, individualized treatment programming, targeting the heroin epidemic. Next slide for that. There it is. So we gave 70 Berks County residents $5,000 beds or less. That's a huge discount. And frankly, the bulk of those went to heroin addicts ages 18 to 30. Okay, that's our target. We want to get them, we want to treat them early in their life, we want to put them on Vivitrol, we want them to not just come to Karen for 21 days. We'll offer a significant scholarship to them if they commit to continuing care in a residential setting after Karen for an additional 3, 6, and 9 months. We don't want you to come to Karen and detox and then leave. We want you to commit to long-term care. We want you to commit to medication-assisted therapy, 12-step involvement. And if you're willing to do that, we'd love to have you. We'd love to have you. Financial assistance available, as Dr. Levine said. We're proud that we give well over $2 million to Berks County. That number is only going to go up this year with the heroin initiative, and we know that, we embrace it. We at Karen embrace our responsibility for dealing with heroin and the drug epidemic in our county and in our nation. Frankly, we do. I love what you said, both docs, about holding other doctors responsible and how that needs to be part of the solution, which is what we're doing. Pharmaceutical companies. For me, it can't end there. If I'm going to be a face of leadership at Karen, I have to represent certain things, and I embrace that. I expect us to challenge our community leadership to do better in their messaging. Someone has got to stand up, or all of us need to stand up and demand that community leaders don't continually spout negative messaging about drug and alcohol treatment. They don't message that heroin addiction is a death sentence, because I gotta tell you, that's how it feels lately. It feels like that at the very worst time, that our community can tolerate that, which is that if you believe there's a heroin epidemic, come to the Karen reunion and see 1,000 drug addicts sober and ask each one of them how many other drug addicts they know, and they'll tell you 100 plus who are in recovery. It's almost like a reverse Ponzi scheme, okay? Do that, and then tell the people to do some more of that and do some more investigation, okay? Our people need that. They need a message of hope. Tell me what a mother or father whose child is on 10 bags of heroin a day, what are they going to do when they read in the newspaper that heroin's a death sentence, that treatment doesn't work? When they hear from community leaders a message of distrust towards the treatment industry, are they coming to treatment, or are they walking away from treatment at the very time they need to check in? Okay, and so that's who we need to be. If I might quote the great Bono, lead singer of U2, the day after Martin Luther King Day. Martin Luther King came in the name of love, and we need to start doing the same. We need to come in the name of love and in the name of hope. Thank you.
Well, just a couple of concluding